This was an interesting case. This was a young woman who suffered an out-of-hospital cardiac arrest in the setting of a non-ischemic cardiomyopathy. Fortunately, she was successfully resuscitated with normal and great neurologic recovery, and so it was decided, given her young age, that she undergo a subcutaneous defibrillator implant as secondary prevention, and that was done at an outside hospital. Unfortunately, approximately a month later, she presented to our hospital with a pretty bad pocket infection. There was pus coming out of the lateral pocket, and based on that, we brought her to the electrophysiology laboratory where we removed the system. It was removed quite easily since it had only been in for about a month, but there was extensive purulent material and necrosis of the area, so we had to do a lot of debridement. We were able to close the pocket well, and she was then sent home on oral antibiotics and a life vest as a bridge. We saw her for follow-up at 2 weeks, and then I think at 6 weeks, and then finally at 12 weeks with resolution of the pocket infection. And then the next question was, what to do. We decided, given that she had a cardiac arrest, she certainly needed another defibrillator, and after seeing how bad the lateral pocket was and how much debridement we needed to do, we recommended a transvenous device for her. But she was adamant about having another subcutaneous defibrillator. She just did not want to have a pectoral device. And so this put us in a bit of a conundrum because she had such extensive debridement done. I didn't know if there was going to be enough tissue left to house the unit. So after some thought, we decided to actually bring her back for a subcutaneous defibrillator implant, but with the idea of placing the defibrillator in an intermuscular pocket, and then employ the CanGaroo envelope as a means to securely hold the CIED device to create a stable environment. When this patient presented, we were just beginning to explore placing the subcutaneous defibrillator in an intermuscular pocket. Now, this is our routine way of implanting a subcutaneous defibrillator. But when this patient first presented, this was relatively new for us. So I think the CanGaroo envelope has a number of distinct advantages. I already mentioned the fact that it's designed to securely hold a CIED in place to create a stable environment. The CanGaroo conforms to the device, it supports and reinforces the pocket, and it creates a stabilized environment that potentially may reduce the risk of further erosion. So it had a lot of distinct advantages that I wanted to use it for. So the question is, have I seen the patient for follow-up and how's she doing? Well, I'm happy to say that we did see her back. The last visit was pre-COVID, and she was doing well. Her pocket had healed up beautifully. There was no recurrent infection. She's a happy patient. She got the device that she really wanted to get, and we were happy in that she had a good result without reinfection. So she's doing well. Now, this patient proves to us that she's at risk for infection. If I recall correctly, she grew out methicillin-sensitive Staphylococcus aureus, which essentially is a skin flora. And so patients who've had previous infection are at higher risk for another infection. And so I was particularly concerned about her risk for recurrent infection. So I was very vigilant in the implant to make sure that we had pristine sterile technique, that we cleaned the pocket well with antibiotic solution, and I think the use of the CanGaroo potentially could aid in that as well. I think on the case report you saw a picture of the defibrillator, the subcutaneous defibrillator within the CanGaroo, and it literally fits like a glove. And you're right, the Azeo CanGaroo is the only envelope available that actually fits the subcutaneous defibrillator. I think there's some nice potential long-term benefits in using the CanGaroo envelope. Number one, based on studies that have been done using these type of devices or envelopes with this material, there's long-term vascularity that can occur. Based on that, having a vascularized pocket may grant the immune system access to the pocket long-term. There's potentially maybe a benefit in that in terms of providing a good, stable environment. The stability within the pocket itself, having the CanGaroo in place because it securely holds the CIED in a subcutaneous system, may preserve the sensing vector potentially. And long term, in terms of time of change out, if there is more vascularity, potentially there's less scar. If there's less scar, then there's going to be an easier change out down the road. So it has some distinct potential long term advantages.